Bipolar disorder is a mental health difficulty where a person can experience high moods and or low moods. A person with bipolar disorder typically will have cycles where you have more intense symptoms and less intense symptoms, and sometimes none at all. And it can be quite difficult to help yourself if you're experiencing those highs or those lows. If you have a particularly intense high mood, it's called mania. So feeling fantastic, not needing to sleep, feeling extremely confident, perhaps also more impulsive. Depression is by far the more common experience than hypomania or mania. And with low mood, you may well find you lack energy, you lack drive, you lack motivation. You find it difficult concentrating or to do things you normally would. Maybe become more withdrawn and isolated, and thinking more negative thoughts about yourself and the future. There is no one cause. It's thought of as being caused by a number of factors. It's thought to have a very high genetic component. If you have a parent or a sibling diagnosed with bipolar disorder, your chances of developing or being diagnosed with bipolar disorder are higher. If you've experienced a lot of stress, trauma, or adversity in your life, your vulnerability to perhaps developing bipolar disorder is higher. You can live a normal life with bipolar disorder. When you're thinking about how best to manage your mood, one of the things that we usually would think is helpful is to look at it from a physical side of things, so how you look after your body. So that can include sleep, diet, routine, having helpful, supportive, caring relationships. If you have supports like psychotherapy, or if you're linked in with a psychologist, perhaps discussing what you're noticing, being able to get a little bit of feedback, looking at what treatments are in play for you. So if that's medication, it might be reevaluating your medication. And for those who are supportive of you in terms of socially, so your family, your friends, see what emotional or day-to-day supports they might be able to do. If you're concerned that you think you may be having symptoms of bipolar disorder, if you do not have a diagnosis, the most helpful thing is to talk to your GP regarding where and who might be able to guide you in your next steps from there. To learn more about supports available for bipolar disorder, you can visit St. Patrick's Mental Health Services website, and you can also call the support and information line.